Hi everyone, thanks for coming on time. I'm just going to give it 1 or 2 minutes just for a few other people to join, and then we'll get cracking. Hey Janice. Have we got Kath here as well?
Yeah, I can see Kath.
Okay, brilliant.
I'm here.
Okay. I've literally just finished my morning clinic and managed to run to Costa, so I'm ready.
Refueled.
Okay, well, it's 2 minutes past 1. I think for the interest of time, we'll get cracking. So thank you everybody for coming today. We've all met before, I'm sure. My name's Abs, I'm a GP and I'm the North West London Cancer Lead for Primary Care. And today we've got the next hour and we're joined by Kath Malhotra, she's the Personalised Care Clinical Lead for RM Partners, and Janice Minter, who's the Lead Cancer Nurse Chair for RM Partners. Thank you both so much for attending today and giving your expertise on this very important topic of personalised care. So just a few housekeeping rules, and I know I say this every time, but please can we just make sure everyone's muted to avoid any background noise, and switch off your videos where you can to keep bandwidth going. We'll be using the chat function, so use that to ask any questions, but do pop your hand up if you have something burning to ask, and we will get through the questions, of course, during the webinar. We will also record everything just to for those individuals who couldn't make it here today, and we will upload this and circulate the recording as we always do. And we circulate through primary care comms teams and through the training hub, so that will go out. Please do comment, ask questions throughout, and we would like things to be interactive, and your challenges and questions are very gratefully received. And finally, at the end of the webinar, we'll put in the link within the chat box for feedback. And please do fill that out before you go. It's always really helpful for us, and every time you have filled out some feedback, it's helped inform future sessions. Great, can I have the next slide, please? So the aims of today are really to focus on personalised care and to understand the story of cancer and its impact also on primary care and how things are changing. We're going to look at what it is like to live with and beyond cancer, and think about the ways of us within primary care, how we can influence things and improve the lives of individuals that are living with cancer as a long-term condition. We're going to touch on some resources so that you can use to help support patients within your practice, and we can think about other education opportunities for us within North West London. Thank you. And so this is just a rough breakdown of the day, and quite quickly we'll get on to Kath and Janice, who will take you through the vast majority of next slide, please. Yeah, great, thank you. So this is just a slide that covers the RM Partners strategy for the next 4 years. RM Partners is our Cancer Alliance, which covers North and South West London. As you can see, personalised care forms one of the key pillars of the strategy, but it's also quite important to say that personalised care is not something that just sits on its own. It's something that's part of every step of the strategy, and also every step of the journey of a patient, from even the point at which you are thinking about cancer as a patient before you even come and approach your GP or other primary care professional within the community. Next slide, please. So this is just a rough kind of brainstorm of the bits and pieces that we will be talking through today, and so you may recognise some of these topics on the slide, but we're going to break things down in a little bit more detail. And so what I'm going to do is just hand over to Kath next, and then we can get things going.
Thanks, Abs. So thank you for handing over. So we're going to look at cancer as a long-term condition to start with. So thank you. Stevie is going to share a poll with you now. So trying to make this a little bit interactive. So it's not just watching, but a little bit of doing. But how many people are living with cancer in the UK in 2020? How many do you think? Is it 1 million, 3 million or 10 million? Okay, so I'm keeping a little eye on the poll and I can see so a high proportion of thinking 64%, 58% are going for the 10 million. Okay, so if we click that, that's done. Actually, the correct answer is 3 million. So obviously a number of people are thinking 10 million. But currently our understanding in 2020 was certainly statistics suggest 3 million. Possibly it feels like more, depending on your day-to-day role. Okay, so next slide, please. So this is the changing story of cancer, and I suppose it's to highlight where we're going with our statistics, but the recognition that over the last 25 years, the population of people living with cancer has doubled to 2.5 million. And our population's older, we're an ageing population. We know that cancer is generally recognised as a disease of age, but at the same time, our cancer survival rates are increasing as well. So there's been a change, I suppose, in the picture of cancer in front of us. And certainly statistics suggest that 1 in 2 of us born after 1960 are likely to be diagnosed with some form of cancer in our lifetime. And by 2040, you can see that the estimation here is that there'll be 5.3 million by 2040 living with cancer. And our focus is really on helping those people to find the best way through their cancer experience. Next slide, please, Stevie. Thank you. So this is an infographic, just again, I suppose, to highlight to you that half of people diagnosed with cancer live longer, for longer than 10 years, which is great to have that survival rate. But we also need to think about the support that we provide. The coordination of the interventions is very complex, as it happens in many domains of people's life and on many levels. Thank you, Stevie. So another question for you. So we're launching a poll again. We'll give you a few moments to complete that. But what percentage of people living with cancer also have another long-term condition? So do you think it's 30%, 50% or 70%? I'll let those fingers keep going. It's the physio in me encouraging some movement over this lunchtime. But yeah, so let's stop the poll here. We've got about 22 responses. And so the numbers suggested here, people are tending towards 43% for 50% and 39% 70. So there's a bit of a mixed feeling in the group, but actually the right answer is 70%. So it's quite a significant number of patients or people are living with another long-term condition. And the slide here highlights those other conditions that people are likely to be living with. So the complexity of cancer on top of living with hypertension, obesity, mental health problems, diabetes, arthritis. And this data is actually from 2014. So if we think about our ageing population, we're likely to be seeing higher figures here as well. So it's just, again, useful to bear this in mind, that we shouldn't be treating things in silo, but we need to be looking at our patient as a whole and the issues that are of concern for them. Next slide, please. I'm going to hand over to Abs now.
Thanks, Kath. So we talked a little bit about having a long-term condition as well as a diagnosis of cancer. And if you think about the average GP practice, which has about 8,000 to 10,000 patients, there will be a handful of those, between 280 and 300 patients that are living with a cancer diagnosis. And we talked a little bit in Kath's slides about the trajectory of cancer and how we're going to have more people living with cancer, and those will be registered patients that register with us. And so the number of people that have a long-term diagnosis of cancer is only set to increase, so set to double by 2040. And these patients that are living with cancer, we know from our data that they will attend more frequently than other patients of the same age or other relative comorbidities. And alongside their physical needs, they will have non-physical needs that are unmet. So things like emotional needs, social needs, and financial needs. And these are the things that often interplay with patients that are living with cancer that sometimes go unseen or unheard. And these things can, and these factors can be involved with those as part of the diagnostic process, but also as part of the consequences of having cancer treatment and things that affect the quality of life that they have right now. Next slide, please. And so this is a slide that's kind of taken from I think Macmillan slide deck, which touches on the issue of living with beyond cancer. Doesn't necessarily mean that you are living well. We know that a significant number of patients that are living with a diagnosis of cancer have other unmet needs, including mental health needs, a fear of recurrence of cancer, and long-term consequences of treatment. And these needs often vary. And what's important to note that it's not a one-size-fits-all system, and one must individualize your kind of treatment package or the way that you manage these patients based on the individual. Next slide, please. So these are the top 10 concerns of patients that are living with cancer, and Kath, jump in of where this data is actually taken from. I wonder whether this is this National Cancer Patient Experience Survey, or is this?
Yeah. Partly that and some of the results from H&A data.
Excellent, thank you. And so H&As are holistic needs assessments, and I think we'll come to talking about those in a bit. So, and the National Cancer Patient Experience Survey is a very useful tool in for us understanding the experience of a patient throughout their cancer pathway. And so if you look down this list, you can see that a lot of these concerns are not physical as well. So things like anger or frustration, simply just getting out and about, memory, concentration, a brain fog is sometimes experienced, and there are some physical symptoms as well. So it describes the complex interplay between physical and non-physical symptoms. Next slide, please. And this, I guess, is another infographic in kind of thinking about the same thing, but in a different way. And it kind of highlights that it may be sometimes tricky to unpick some of these symptoms, as they can have overlap with other chronic conditions. And we've said already that our patients with cancer, those who are living with cancer, will have other chronic diseases. So it's not uncommon to have some level of body image issues, nausea and vomiting, urinary or bowel issues, or other kind of physical symptoms that may happen as a consequence of cancer or its treatment. And so I guess it's important when we think about how we help our patients in the community to address some of these things specifically. Next slide, please. And I think I'm back to Kath now.
Put my camera back on. So this highlights, this is quite a busy infographic, but actually captures a lot around the NHS long-term plan, which within that highlights the real need for personalised care. And even within the long-term plan, there's a shout out specifically towards cancer and ensuring that we address the personalised care needs. But you can see that this is around really a shift in relationship between us as healthcare professionals and the people that we're interacting with. So it's about encouraging us to see the person as a whole, to give them the skills so that they have, there's an opportunity to share knowledge, that we look at the choice and control that is available for them, and that there's the opportunity for informed choices and decisions that people can make. And very much it is that shift in relationship to ensure that there's partnership working. And rather than exploring what's the matter with our patients, it's about ensuring that we ask what matters to you. So we go on to the next slide, please, Stevie. Now, this is taken from the work from the Health Foundation, which is a great resource when you want to explore around person-centred care or the language of personalised care. This isn't a new concept. It's actually part and parcel of what we do on a day-to-day basis. But I suppose it's about ensuring that we understand what we're trying to do and how we're taking the work forward to really the most important point, I think, on this slide. It's quite busy with lots of text, but it's that enabling approach so that we are working alongside our patients to ensure that they're supported to build on their own capabilities, and really trying to tailor the intervention that we're providing. Next slide, please. And I thought it's quite important to give a shout out to this approach, the what matters to you. I'm not sure if this is familiar to people on the call, or whether you've seen this before, but this is a national approach that's been adopted in NHS Scotland, and very much around encouraging services to think about utilising this key question of what matters to you with individual patients. And then it's up to services to adopt this approach and, I suppose, tailor it into how they would then, whether it's a question they ask for the beginning of a pathway or a question that's asked each time a patient comes into a clinic, but ensuring that what you're doing is very much around what matters to the patient. And I know in some of the trusts up in Scotland, it's been utilised where that is what they start each MD team decision-making discussion, is actually focusing on what matters to that individual patient. So although they may not be in the room, there's an understanding what's important to them. And again, it's about highlighting, establishing a relationship, gathering that insight and encouraging meaningful conversations between the health and social care providers and those who use the services. Next slide, please. So I'm going to hand over to Janice here.
Hello, everyone. So I suppose building on what matters to you is around what we're trying to deliver with personalised care. Looking at the way we're working as key stakeholders to deliver these interventions under personalised care. We've got personalised care and support planning, which is holistic needs assessment, end of treatment summary, which is completed in secondary care, and I'll go into a bit more detail about all of these interventions, and cancer care review, which is a discussion between a patient and a GP or stroke nurse, and health and wellbeing information. This is very much a key part of my role as a lead cancer nurse. I actually work at St George's Hospital in Tooting, but I know this is something as lead cancer nurses across the Alliance, we're all very much passionate about how we can deliver personalised care to our patients. We know that if we deliver good personalised care, that will improve our cancer patient experience, which obviously very much sits with why we undertake this role. Next slide, please, Stevie. So one element that I'm talking about is the holistic needs assessment. I don't know whether any of you have seen a holistic needs assessment and a care plan that goes alongside it, but holistic needs assessment is about how they're usually predominantly completed in secondary care, so under us in the hospitals, and we meet with a patient at diagnosis and at certain interventional points during their pathway to understand any needs that they may raise. So it's very individualised. So it may be something that we actually don't think as professionals that's going to be raised as a concern, and then the patient will suddenly say, actually, my dog is my biggest concern. I'm being flippant, but it could be anything about what can come out and surprise us. And then we build a plan of care that can support that patient with that. These assessments are great. We get great feedback from the patients that are completing it and the plan of care that goes alongside it. The issue that we do still have and that we're working on as stakeholders is how we make it more transmissible between secondary and primary care, as they're quite clunky. We have a mixture of paper HNAs, eHNAs, Macmillan eHNA you might have heard of, and we get a lot of trusts are using that. Look at your trust that you come more into contact with. Imperial, I know that they use eHNA in place, but on Somerset, where some of the other trusts are looking at are still using paper. So it's quite different across organisations, and that doesn't help. It doesn't actually help very much at all in having a smooth process of how we can transfer the information between secondary and primary care. So it is something that we're very much working on, is how we can improve that. Next slide, please. looking at next onto the interventions is treatment summaries. I don't know if Stevie is slowed up. I don't know if you have got the next slide, Stevie. It might just be it's a bit slow coming through. Next intervention that we're talking about is around end of treatment summaries. And again, another challenge from an IT point of view, in the fact that, again, we're not there yet with how smooth we want this process transferred between secondary and primary care. Mostly treatment summaries are done at the end of treatment for patients. There's always a little bit of a discrepancy about when people are saying end of treatment is, and that does put off some of our people, and it does put off some professionals sometimes of undertaking what an end of treatment summary is, because people are saying when is end of treatment, and we know that's an issue and we're trying to improve that. Also, end of treatment summaries can come in various different ways at the moment. So this is an example of an end of treatment summary on this slide. But we know some consultants at the end of a consultation will write quite a comprehensive letter. But again, what the problem is in primary care is then seeing where that letter gets saved, how clear it is, because they can be very descriptive, a lot of information in them, and what are the key points. So we're trying to do some work to how we can make this end of treatment summary a document that is both valuable to patients and to secondary care and primary care. I don't know how many of you have seen a treatment summary. If anyone has seen one, I'll give you a couple of minutes if anyone puts a hand up to say if they've seen an end of treatment summary. If it was South West London, I'd be very surprised if many people put up that they've seen one. No, okay. So this is where we really have to do some work, and I think this is really key, because Lindsay Williams has. Hi Lindsay, where do you work?
So I am cancer lead for Brent and Ealing, and I worked really closely with the Macmillan nurse lead at one time, where we were working with primary and secondary care engagement. And so it was London Northwest was producing these treatment summary plans with the Macmillan lead nurse over there. But I'm going to be honest, it was a while ago that I was in that post, because I went on mat leave and I've just come back in and I haven't seen one since. So yes, I have, with the caveat that was a little while ago and I had a baby in between then, so that gives you an idea of time scale.
Absolutely. I know when I'm my background's urology cancer, and I know very much that we were starting the process at St George's, but I have to say we didn't have the process set up as how we want it to be, and we're still working on that. And I know it's very much a priority for us as key stakeholders that we are looking at how we can improve this, because if we don't get the treatment summary part right, it's going to be very hard to lead into the next intervention, which I'm going to come to in a second. So that's what we're trying to do with the end of treatment summary, and we want it to be sort of a workable and visible document to moving forward. And that then leads us into thinking about health and wellbeing information, how we signpost people to the right health and wellbeing information. Also links in with what Abs is going to come on to a little bit, the end of treatment summary, about cancer care reviews, but I'll let Abs talk about that in a bit more detail. But we also need the health and wellbeing information. So hopefully, if a patient has a good holistic needs assessment at the end of treatment, they had an end of treatment summary, they could be quite well signposted then to the support services that are available that could help people. And that's the information that they need to support them during their pathway and after treatment. So we know that health and wellbeing pre-pandemic, we ran some lovely events that were face-to-face. People would have one-to-one sessions, whereas unfortunately a lot of that got put on hold with the pandemic. Things are starting to come back on available now, and we are running quite a lot of events across the Alliance that are done on Teams, which people are really engaging with, and they seem to be doing really well. The other good resource out there is obviously Macmillan have great resources. Maggie's has a great is great for support, providing the support, as well as a lot of interventions in secondary care. A lot of organisations do run health and wellbeing events. As I say, predominantly online. And then there was a great link for the London Cancer Wellbeing website as well, which is a great resource as well to share with yourselves and for your patients. Okay, I'm going to pass over to Abs now.
Thanks, Janice. That's really helpful, and it brings us to the cancer care review topic, and it's something that we will do within primary care. Before we kick off, I mean, I'm sure everyone's heard of a cancer care review. Could we ask just a question? We'll do the poll again. So who carries out the cancer care reviews in your practice? Is it GP, an A&P, a nurse, HCA, pharmacist, or somebody else? We should get that poll going. Okay. So we've had a few responses. So that's really interesting, isn't it? So there are a handful of GPs that do it, nurses and ANPs, and other, really interested to hear other clinicians. Do you mind, those of you that clicked on other, just type in the chat box who that is that does the cancer care review? That'd just be interesting to reflect on. I guess in a way, this we can close that poll. Thanks, Stevie. So this actually, that reflects that there are different people within the MDT, within our primary care MDT, that can do a cancer care review. It doesn't have to be the GP, although sometimes you'd want it to be a GP. We've got social prescriber or link worker here, and that's really interesting. We can come on to that as well. Thank you. So let's move on to the next slide and talk a little bit about cancer care reviews then. So we know that with the introduction of the new, with the changes to the QOF indicators for cancer, it actually helps in a way of how we can deliver some of these key aims of personalised care and timing things in with the treatment summaries and cancer care reviews. You will remember before we had the indicator of reaching out within 6 months to do a cancer care review, which I always felt was not particularly helpful, and sometimes patients are still very much under the realm of secondary care, having active treatment and having a meaningful conversation within primary care at that stage felt challenging. I certainly do a lot of the cancer care reviews at my practice, and I found that a little bit difficult, and the timing was always just not quite right. So now we've got these two things have changed, which I think is much better. Within the first 3 months, we need to, and that's during the time of patient's diagnosis, is to reach out and offer some support. And then doing the formal cancer care review within the 12 months post-diagnosis. And if we go on to the next slide, we can talk a little bit about the practicalities of that. So these QOF indicators, we know for 21-22 were supposed to come in, and they were awarded or moved towards kind of prescribing indicators because of the pandemic. And now for 22-23, they will become part of normal practice. And so, as said, the cancer care review, to do a structured template recorded cancer care review within 12 months of their diagnosis, and thereafter also within 3 months, is to offer support available from primary care. Now, when we think about doing the cancer care review within 12 months, as Janice said, if we have that treatment summary, and ideally moving forward, that would be a great aim of ours, to have a treatment summary that's provided by secondary care, so that we can have a structured conversation based on some of this information, any holistic needs assessments that are also done and shared, and we can have a more joined up conversation between primary and secondary care. Sometimes a recurring theme from the National Cancer Patient Experience Survey is that primary care and secondary care are, disparate. There are different entities, and we're not joining up our conversation, and we're fully aware of that. And these are, as Johnny said, these are the kind of things we're working on. And if we go on the next slide, we can talk about how we can start to integrate some of these things. So this is a letter that I think we put together in Hammersmith and Fulham with the Macmillan Right by You service a couple of years back, and I was a borough cancer lead back then, and this was in response to the social prescribing team, which had a specific focus for cancer and were employed by Macmillan. So the focus of the social prescriber, so link workers, was to offer support for patients that were newly diagnosed with cancer for their non-medical and holistic needs. And someone in the chat box has mentioned that cancer care review has been done by a link worker or social prescriber. So and we put together this letter so that when patients had a new diagnosis, that was coded within primary care, and we got that MDT letter, or that first secondary care specialist letter, we would reach out from the surgery and send this letter to the patient. And quite holistically invite them to come in and have a chat with one of the link workers. And within this, we also mentioned that you could book in a time to have a cancer care review. So this is a rough template of something that you can do, and you can contact the patient from the surgery proactively to offer support. And you may want to link this in with your link worker, or have a system locally so that support can be offered. There are other means of offering signposting patients, such as the Macmillan Services or Maggie Centre. And there are we've also got the Cancer Care Map, which is something that we often refer to within North West London as well. If we go on to the next slide, this talks about the template. So we've the Macmillan Cancer Care Review template is something that you can find on System 1 or EMIS very easily, and it's a very it's a nice and structured way in for us to get those key QOF indicators, so that is done, but also have a meaningful and structured conversation with a patient. Now, we've said that needs to be done within 3 months of diagnosis, and it helps identify some of those holistic needs as well as the physical needs as well. Now, like we said, this doesn't have to be done by a GP. This could be done by the practice nurse or a pharmacist or anybody else who has an interest in cancer. And I think what is helpful sometimes is to just have not just do the cancer care review, but also to have an action plan. In the same way within secondary care, if a H&A is done, and then you would want to have a care plan in place because it addresses some of the needs. So I think sometimes we can fall into the trap of doing the cancer care review just for the sake of doing it to meet QOF. I think it's quite important to actually have a system that when we identify any key needs, to have a plan that's made thereafter of how we can address this within primary care. The treatment summary and the aim of the treatment summary would be, if there are any key physical red flag symptoms, to have an understanding of when to signpost back into secondary care and what things there are to expect from long-term treatment. But when we think about the holistic and non-medical needs, having an idea of what's available in your borough is key and can really help our patients at the point of doing this cancer care review. Your link workers and social prescribers will probably already know about this, and touching base with them, and whoever does the cancer care review, it's something that's quite advisable and something we've done in Hammersmith and Fulham. Next slide, please, Stevie. Thank you. And finally, from me, Eortc is a useful tool and something that I use regularly, and I think is available in pretty much all practices in North West London. And Macmillan have set up a template to help the cancer care review. I should say that you don't have to do the cancer care review face to face. If you think you can get a meaningful conversation virtually through video consultation or telephone, you can do to meet QOF. But I would say that, you know, individualize that for each patient and make sure that if you feel and the patient feels that it is better to do things face to face, then please do try and facilitate that. But there is, if you would like to use Eortc in order to help deliver your cancer care review, you can find that by going to the clinical section down to useful services or searching Macmillan support services, and that will help you send those links out. Great. Next slide, please. And I'm handing back over. I'm sorry, I don't know who I'm handing over to. Kath or Janice? Kath. Thanks.
I get the joy of data. Thanks, Abs. What I will point out as well, the slides you will see will have a number of links actually already set up. So hopefully when the slide set is shared, you'll be able to go directly to a lot of the links that we've highlighted for you. So I'm going to talk a little bit about the National Cancer Patient Experience Survey, or NCPES, as a lot of people refer to it, because we do love acronyms. And it's really just, I suppose, to highlight that this is currently being formatted. We should get the results. It says spring 2022, but I think the national team have muted that the results of the latest survey will be made available in July. And I think it's just important to highlight that there are different aspects that are relevant to a number of different points in the pathway for patients. It's designed to monitor national progress, but it also allows us to look at alliance level and also at individual trust level on how services are performing, and also at CCG going forward. So it's a mixed mode survey. It was first launched in 2010. And in fact, it last ran in 2020, but at that point, we were obviously in the midst of a pandemic. and collecting data was very challenging. So a number of trusts volunteered to submit results from that, but it's very limited response rates. So the data that we've been looking at the moment is 2019. Which collected over 67,000 responses. And I think it's just important to highlight that the survey that is currently being utilised has been completely revamped. So there isn't going to be the opportunity, I suppose, to directly relate the responses this year to the previous data collected. So in a way, we're starting fresh. It's an opportunity to start new and look at our individual services. And there's been a whole new section revamped on living with and beyond cancer, which links with the long-term plan priorities. I thought it was also useful to just highlight that the people who are sent the survey are the sample period is those that were admitted between April to June 2021. So their experience could be very different. We were in the midst of a pandemic at that point, so it'll be interesting to see what the responses are. But there will also be patients who are listed as either inpatients or as day cases, and individual trusts often list patients in a different way. So we're not necessarily capturing the experience of the majority of the population who are outpatients. And I think going forward, there is a plan to change that sampling approach for next year's data collection. Next slide, please. So we thought we'd just give you a couple of snapshots really of the results from 2019, taking it down to the level of the CCG performance, particularly focusing on primary care. And you'll see the orange line there is kind of highlighting the national score, which was at about 60. And Central London and West London have the highest satisfaction. So it's not a competition, obviously, but it is useful to, I suppose, to explore where you're standing in relation to people around you and what the expectation is of our patients. If we go to the next slide. This was actually a question was around once cancer treatment was finished, how satisfied people were about the care and support from health or social care services. So thinking more about the wider primary care provision. And here you'll see not winners, but Central London and Hillingdon had the highest satisfaction scores. So it's interesting to think about what's available in those areas. And really what we should be doing with the results of the surveys is trying to target down what innovations, what areas of practice can we look to enhance and improve. Okay, next slide, please, Stevie. So certainly what was highlighted, and this will be no surprise to people, is that there are a number of inequalities around patient experience and outcomes. And there's been work from Macmillan, so there's the Mind the Gap exploration. But we know that people in the most deprived areas report the worst experience than those in the least deprived areas in practically all aspects of their care. And we know, unfortunately, that London is the worst hit than the rest of England. So if you move on to the next slide, this again sort of picks up that this was taken from the NCPES survey and links to the Macmillan report that, again, no surprise here, but people from lower incomes almost twice as likely to report a need for more emotional support and also wanting practical support for inside the home. So I think we just need to bear this in mind when we're thinking about the demographics of our patient population, and certainly there's a lot of work at a national level around health inequalities, and it's a remit of the work that we deliver across the Alliance as well. And this links in with work by TCST, which is the Transforming Cancer Services team, who are looking at this as a pan-London approach as well, because ultimately the issues that we have in West London are very similar to those affected by other cancer alliances across the region. Okay, next slide, please. So this is a new metric that was launched in the mid of 2021. It had a bit of a soft launch because the NHS was busy with other things, but we have now a metric for cancer's quality of life. And this is a survey that's delivered 18 months after a diagnosis. And the importance, I suppose, the the issue around the quality of life survey is that we know that the quality of life outcomes are important for people living with and beyond cancer. And measuring people's quality of life is about understanding the impact of cancer upon them and its treatment as well, and how well people are living after treatment, which is why it's delivered at 18 months. We've never had an opportunity, other than research studies, to really explore this with a wider data set. So the NHS is committed to raising the profile of quality of life outcomes so that they're equitable alongside survival, so that we've got more patient reported outcomes rather than just doing the number crunching of who else is living. We need to, again, enhance that opportunity for people to live well. So you'll see from the slide here, the intention of the quality of life metric is that it will guide the National Cancer Programme, allowing it to set the priority, but it will also ensure that at a regional and an alliance level, we can look to see if there are aspects that we can introduce to help improve the experience, but also to highlight where there is evidence of good practice as well. And the intention is that we are empowering our patients as well. Okay, next slide, please. So this is a snapshot. So obviously you have to look at this with squinting eyes, but it highlights the patient summary. So this was some of the work that was done. So the survey went live late last year, and we've had one set of data so that was released in October 2021. So and the data will be released on a quarterly basis, and that data was targeted solely at breast, colorectal and prostate patients. But following October, from then on, all surveys are now sent to all cancer diagnostic groups. So we're going to be able to capture a wider range of understanding in relation to individual diagnostic groups. But when a patient completes the survey, they can complete it electronically, or they can request for it to be sent to them in paper. The system's pretty clunky, and they are definitely learning that the response rate is still quite low. So there's some lessons to be learnt on how to improve the response rates going forward. But when a patient completes the questionnaire online, or if they complete it by paper, they will eventually in the post receive a paper copy of their patient summary. If it's done online, this is generated immediately. And you'll see that it will highlight, in response to the questions that they've answered, it will highlight if things are a red, amber or green. And I've been advised that there was a lot of work in the initial piloting of this to try and come up with a document that was more user-friendly with the patients that they trialled this with. And I suppose it's highlighting to you that this is likely to be a document, she says optimistically, that your patients will bring to a consultation with you out in GP practice, or out to the practice nurses, or even potentially to the social prescribing team. Optimistic question here, has anybody seen one in practice yet? I suspect there aren't going to be any hands raised on this one. But we're hoping, she says optimistically, that this will become part and parcel and empower our patients to take this forward and have that conversation. Okay, if you go on to the next slide for me. I thought it was useful, just, I suppose, to just give you a snapshot of some of the data. Again, you have to look at this very closely, but it's highlighting the incidence of problems reported in aspects of health. And certainly, we know that people living with and beyond cancer are significantly more likely to report a problem across each of the 5 aspects of health, which are compared against England, but also compared against the national average. So there are issues around mobility, and then any aspect of health obviously scores quite highly, and anxiety and depression, and also pain. Mental health is a priority for the National Cancer Programme, and there is work definitely to take forward, ensuring that we're providing the emotional support and the psychosocial support alongside that, to try and address that reducing the fact that at 18 months people are still highlighting that they're struggling with anxiety and depression. If you move on to the next slide, this here sort of highlights, so the quality of life metric involves two questionnaires. One is the EQ5D, which highlighted those 5 aspects, and is quite a standard measurement used within cancer and wider than that as well. But we've also got the Eortc quality of life, which is a C30 metric, so it's got 30 questions, but they relate to these quality of life symptoms. And you'll see there's lots of obviously different shading. So the darker shades highlight where it's considered a significant issue. So interestingly, at 18 months, the issues are around difficulty sleeping, and that's highlighted. And we're very aware that actually sleep hygiene is something that we don't address very well. We don't address that early on in treatment, but we possibly don't address it later as well. And there's, I think, beginning to understand different ways of supporting people, that actually we know if people have poor sleep, it has such a knock-on effect to other symptoms, particularly around fatigue, but also anxiety and depression, and it becomes a vicious cycle. Okay, next slide, please. So the reason that we've highlighted quality of life, or that I've ensured, it's important that we're aware of this. It's important for you out there to be aware that patients may come to you with a summary, but the response rate for the questionnaire, a national average is about 50%. For RM partners, our average of response rate is around 43%, but we've seen that dropping since it's going out to a wider population beyond just the breast, colorectal and prostate cancer patients, who obviously are a larger patient group. So there's something here around what we can do to try and promote the quality of life survey. 18 months ago, this wouldn't have been in the conversation for patients entering into a treatment pathway. So they're not going to be aware that they're likely to get this survey. So we want to try and promote the uptake of the survey and make it part of the conversation. So potentially in the cancer care review, you can highlight that that person that you're talking to at 12 months is likely to get their survey when they're 18 months post-diagnosis, and encourage them to complete it. We need to obviously promote the awareness to our stakeholders, which is part of why we're talking about it now, and think about considering the quality of life across the pathway, and ensuring that we embed it into the culture of personalised care. Okay, next slide, please. Okay, so as I said, we've created all these hyperlinks just to make life easier for you rather than tapping into Google. But actually, a lot of these will also be highlighted in the cancer care map, which I'll show you in the next slide. But there are a number of resources available to you, such as Age UK, thinking about if you have a younger patient population. There's resources within the Teenage Cancer Trust and with Trekstock and Ellen MacArthur, which links in with sort of really encouraging active lifestyles for younger patients. And the Breast Cancer Now have just introduced a new service called Here For You, which is providing telephone support for newly diagnosed primary breast cancer patients, but also for secondary breast cancer patients as well, and they need to be referred by the healthcare professional. But there are obviously a number of other services available to you as well, and it's just useful for you to think about what services are there available for you for your patients in your borough. And making yourself aware of those. And I often think we learn from our patients, because they'll often highlight something to us that we weren't aware of. And then that precipitates maybe the next conversation with another patient that you can share that information. Next slide, please. So the cancer care map, I'm aware that Abs mentioned this earlier. So this is a resource, it's a national resource, but it started life out at Guy's and St Thomas's and is updated and managed by the Dimbleby Centre over in South London. And because it's got a team updating it, you can be confident that the information that you can find on here is up to date and valid, because we know what directories are like. They can be really challenging, and the news and information on them can be quite old hat. you can tap in by postcode, city or region. It will have local services, but it will also have a lot of the charities and support groups that may be offering services at a national level as well. So it's a great resource. But if you come across something that you think you really want to shout out and highlight for your local population, please encourage that service to submit their details to the team at the Cancer Care Map. It takes about 10 days to get that information uploaded, and then it's there and it's available for a wider range of people to see. And you can highlight if it's specifically for a patient population or specifically for certain patients who are listed with a particular trust, etc. Okay, next slide. There you go. So it will show you the map and give you far more details. Thanks. And then, we've had a bit of a shout out today, haven't we, to the social prescribers. They are fantastic resources and increasing in number and increasing in skill set. And we're working very hard to work in partnership with them. So you can see that there are a number of resources that the social prescribers can refer people to and link people with, such as Maggie's. We mentioned that today. So we have Maggie's at Charing Cross. There's a lot of guidance around financial support from Citizens Advice and from Macmillan. And then certainly services in regard to physical activity linked with Macmillan. And there's a small shout out for the Walking for Health programme, which is a partnership working between the Ramblers and Macmillan. But again, it's a great resource. Put your details into their website and it will highlight if there are walks local to that person, and they can be walks that are beginner orientated or for sort of intermediates, and they would be guided in a group. And there's very much something around highlighting the need for peer support. Okay, next slide. I'm mindful of time. So we just felt it was really important to highlight as well. This is so prominent in the news at the moment, isn't it, in regard to the cost of living and the increase that is impacting upon all of us, but particularly for our patients or people living with cancer and other long-term conditions. But Macmillan are doing some significant work here to try and support and guide patients. So there are Macmillan Grants that can be made available. That needs to be requested through Macmillan teams, and there are also some online financial guides and the opportunity to access the welfare rights advisors. And really key at the moment is the energy advisors, sort of highlighting how people can be linked in with energy schemes and grants, which is so prominent in the news with the steep rise in fuel costs, etc. So there's some information there, and the availability of the advisors, and noticing that the welfare rights advisors are available as well on Saturdays and Sundays. Okay, next slide. Janice talked about the Cancer Wellbeing London website. So there are a number of videos that are already hosted within the website. It's a little bit clunky at the moment, but there's work afoot to make it more user-friendly. And it was born before COVID, when life was face-to-face. And at that point, the intention was that people would be able to list what events were going to be available in different locations, and then people could access that and book themselves on. That will eventually come back into play, but there are already a number of videos that highlight different aspects or areas of concern that people can access for health and wellbeing. Again, a great resource. Next slide. And then obviously this is an education opportunity, but there are a number of resources available out there. Again, we've made life easy for you with links to the various resources highlighted. But the Personalised Care Institute is the broader dimension, I suppose, of personalised care, which isn't just looking at cancer, but highlights a number of other aspects linked with long-term conditions. And within that, there are a number of e-learning modules, but also some fantastic blogs and podcasts that are definitely worth listening to, because they're very much the lived experience of the clinicians trying to integrate aspects of this into practice. There's the Prosper resources that have been developed by Macmillan, And there are different, in inverted commas, personas linked to those. And there's also the Learning Communications Hub. So if you have already registered with Macmillan for some of their learning resources, you may have registered into the Learning Hub. They've now redesigned and set it up, but you have to get another link. It takes a couple of minutes to set yourself up, but again, it's a great resource. You should all be aware of the Red Whale training that has been made available across for primary care teams. And this is free cancer education programmes which have been offered online, and there will be some face-to-face opportunities as well. You've got the Guy's Cancer Academy have some resources. I've highlighted here the Physical Activity Clinical Champions training, which isn't cancer specific, it's more around the management of long-term conditions. But this was born out of work by OHID and Sport England, and is free training that will be available at least till the end of this year for teams to talk about physical activity and increase their confidence to have that conversation with patients. And then we have a number of resources that have been developed by Macmillan to help guide with cancer care reviews around primary care, nursing and practice nursing, and also the Healthy London work as well. Okay, next slide, please. So this is my final food for thought, which is a pun, obviously, because we're here at lunchtime. But as I've said, it's not all about the quaff. So it's not all about hitting the target. It's actually thinking about the patient in front of you, and thinking about cancer as a long-term condition where for many there are still unmet needs years post-diagnosis. So if you've got your diabetic patient with you who's had colorectal cancer, or a patient with cardiovascular disease who had breast cancer, or your COPD patient who's come to you for a review but's had prostate cancer, just think about what you might do differently in your day-to-day role to support them. Okay, I'm going to hand over to Abs now.
Thanks, Kath. Well, first of all, I'd like to just start by thanking Kath and Janice and just say thanks so much for your time. Thank you for coming and talking us through your expertise in personalised care. I think we've learned quite a lot today. We talked about H&As and treatment summaries and how these are done within secondary care and how they actually provide a really good insight to patient concerns, and how we will soon see them within primary care and shared within our primary care record. We talked a little bit about cancer care reviews and having the right person in place to do this and making sure that they have the right training and access to deliver personalised care. We talked about the Cancer Quality of Life Survey and encouraging involvement with this within primary care, because this is only going to improve our insights if we engage within this, and only going to improve the way in which we as a team can offer the best support for our patients that are living with cancer. And think about other people within the MDT, so the social prescriber colleagues and everyone else. And there's a comment from Lindsay here within the chat box about and it talks about having a document readily available for voluntary and charitable services. And I think that's tricky, isn't it? Because it's very borough-based, but the cancer care map is something that we've certainly encouraged to be able to do this. So you can put your postcode in and do that. And I know within Hammersmith and Fulham, our link workers that had a cancer work stream, they were looking proactively to try and create a little database that they would share within the practices locally. So that may be something that you want to encourage within your own borough. So lots of learning there today. We've got 1 minute left. So if there are any other questions, please do either whack it in the chat box quickly within the next 60 seconds, or you can always email us at rmpartners.primarycare@nhs.net and we will get back to you. Stevie, if you could please put the smart survey link within the chat box, and then if you could all please just take a couple of minutes to fill that out, that really helps us. And within the series of our education programme for North West London in cancer and primary care, our next one will be on the 5th of April. That's today. So that there will be another one in May, and that's going to be on RDC's rapid diagnostic centres and the provision across North West London. But we'll send out some comms about that. So thank you once again, Janice. Thanks, Kath, and thank you everybody for coming today. And have a good afternoon. Take care, everyone.